scoliosis braces we actually recommend. When patients receive a diagnosis of scoliosis, they very often start looking for different treatment approaches. And when they start studying and doing some research, they kind of figure out very quickly that there's two specific approaches when it comes to scoliosis. One is something that I call traditional treatment options, and the other is conservative treatment options. And these two different treatment approaches will kind of guide patients or lead patients to different outcomes. And really how a patient responds to this diagnosis in terms of which type of treatment approach they choose could really determine what treatment they end up receiving and whether the patient actually ends up in a severe scenario where they're considering a spinal fusion. The traditional approach is more reactive. It's literally the number one treatment option is really no treatment at all. It's just watching and waiting and see if the curve progresses to a point where now the curve has become severe enough that it risks spinal fusion, which involves spinal surgery. It involves rods and screws and fusion within the spine. And this is, of course, a very invasive, high-risk type of surgery. And because all you're doing is watching and waiting, there's only a small portion of the population with scoliosis that they actually treat outside of just watching and waiting until the curve becomes big enough to do scoliosis surgery. The conservative approach is more proactive. It's more about applying treatments as soon as possible. And the goal is to try to work not only to try to stop the curve progression, but number one is to try to improve spinal function. It's a more functional approach. And by improving spinal function, the goal would be is to actually reduce the curve so the patient never has to face the decision of spinal surgery or fusion. The only treatment option outside of watching and waiting and surgery is something that they use is something called Boston braces. And Boston braces is the number one most commonly used traditional brace system. It's only used in patients that are going through adolescent growth spurt, and it uses a very significant 3-point pressure system to try to squeeze the spine to prevent progression during this one phase of growth progression. This is adolescence, typically somewhere between 11 and 13 or 14 years of age. They're used a Boston brace, and the goal of the Boston brace is just trying to prevent this progression process in this stage. And again, and then to even further categorize this small group, it's only used for patients between 25 and roughly about 40 to 45 degrees. So if you're in that age group and you're going through growth spurt and you have a curve at this size, then you're recommended this type of treatment option, which is a Boston brace. Unfortunately, the Boston brace is associated with many shortcomings. First and foremost, it just squeezes the spines from the side. This squeezing effect, unfortunately, I have noticed can cause some weakness to the muscles and ligaments and tissues surrounding the body. So therefore, the big effect is when you remove this Boston brace, since it's not actually making any kind of geometric changes to the spine, not addressing what's actually the spine in terms of reducing the size of the curve, whatever was going to progress, theoretically we see is patients progress to what that number was going to be because they're not actually making the spine better. It only addresses the spine as a two-dimensional process, meaning squeezing from the sides, when scoliosis, unfortunately, is a three-dimensional issue. This type of squeeze can actually increase postural deviation in specifically rib deformation or rib humping. When you squeeze from the side, you actually can push the ribs further back and further forward, and it can make the rib deformation or the rib humping actually more severe, which is something that is very negative to a scoliosis patient because the more severe the rib deviation becomes, the worse it can pull the spine out of alignment. Stopping progression is really the only goal when it comes to this Boston brace. It's not really trying to correct the spine, improve posture, improve function. It's just trying to slow down progression. And compliance becomes a very big issue because these things are mostly mass-produced. They're pretty much tubes. You can see most patients could share their Boston brace if they're roughly the same circumference. They're not super curve specific, unfortunately, and they normally become very uncomfortable to wear over time. And this is the number one sign that the spine is actually worsening, that the curve is actually getting bigger because the brace is not slowing down the progression enough, and you're putting the same brace on a bigger curve. It makes sense that it will become less and less comfortable over time. The good news with today's technology, there's many alternatives to Boston braces. Modern braces, dynamic braces used to help manage and reduce scoliosis. The brace system that we like to use is something called a Scolibrace system. And by simple words, the brace is a corrective brace manner. It doesn't try to squeeze the spine, but it pushes the spine to provide actual correction or improvement in the body and the spine and the tissues and the ribs. Because we're not squeezing and we're pushing, it doesn't create a weakness. It actually creates strength, because when we're putting the spine into a proper position, this push creates an internal reaction that we believe creates muscle strengthening and muscle development, because the spine is pulling the spine and the muscles and tissues out of alignment. It also addresses the spine in a three-dimensional manner, meaning it's not just dealing with the bends, but it's also dealing with the rotational component. And in addition, it's dealing with the compression component associated with scoliosis, meaning as curves get bigger, the torso tends to decrease its length. We have to lengthen the torso with this corrective brace manner. And because it has corrective results as its end goal, each and every brace is customized one by one to that patient's curvature. And as they're improving, their brace becomes easier and easier to wear. And because it becomes easier to wear, compliance is better. And most importantly, patients start seeing results specifically in their posture and their torso. And that alone becomes a very motivating factor to continue. The way I like to compare these things is very simply like this. If you had to put braces on your teeth and your orthodontist said to you, well, the best thing your braces on your teeth are going to do is hold your teeth the same, nobody would do it. I mean, who would want to go through 2 years of bracing on their teeth? To the very best outcome will be is your teeth would be the same, or maybe hopefully not worsen severely. Where people wear corrective braces on their teeth because the goal is to get your teeth as straight as possible. Well, why wouldn't the same thing be used with scoliosis braces? And the reason why is because of the way they're designed. And the last thing to mention here is not only the design aspect in terms of having a corrective brace, but it's also the management. Meaning the more corrective the brace is, the more the patient needs to be managed to try to reduce the curve further. Just like braces on your teeth. When you get corrective braces to put on your teeth, you don't come back 2 years later with your spine completely straight, your teeth completely straight. You have to go in and be treated by that orthodontist as he tightens and works the braces over a period of time and alters the brace, your teeth braces, to provide the best outcome possible. When it comes to traditional braces, mostly Boston braces, they're normally given the same brace. And the only reason why the brace is ever changed or modified is because they outgrow it. They're not changing or modifying the brace to provide a better outcome, meaning trying to correct it better. They're just responding, again, to either the growth or the progression of the scoliosis. Again, that's not the way you manage a reduction. That's the way you try to slow down progression. Since we're trying to manage a reduction, we alter these braces very quickly in the corrective stages to try to produce as much reduction as possible. Lastly, I want to mention is that scoliosis braces alone are not the only tool to help reduce the curve. They work as an adjunct to other types of treatment, and each will complement the other. And other type of treatments that they can use are things that are normally in office. It's things like chiropractic care, in-office therapy, in-office rehabilitation, in-office exercises and neuromuscular education. In addition, there's also home exercises that can be prescribed to complement all the other therapies. And the key thing is to make sure that your brace, your office therapy, and your home therapy are all coordinated to provide the very best outcome, to make sure that everything is complementing the other treatment to provide the very best reduction for your scoliosis. At Scoliosis Reduction Center, we definitely offer proactive treatment models for scoliosis, and our main goal is conservative treatment, functional treatment approach that's not only going to try to slow down your curve progression, but more importantly, reduce the curve so you end up with a smaller scoliosis, not the same or bigger. We favor Scolibraces when bracing is needed, and the braces that we want to design are going to be aggressive braces to help reduce the curve, and also we need to manage that brace appropriately to deliver the very best outcome. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.